Okay, I'm Bridget Taylor, CEO and co-founder of Alpine Learning Group, and I wanted to welcome you to Alpine Learning Group's Innovation in Autism webinar series. Alpine Learning Group offers a full range of diagnostic and applied behavior analysis-based educational and clinical services to individuals of all ages. Each year during Autism Acceptance Month, we share our expertise through free webinars and make them available to the community. I'm so thrilled this year that our webinar series is presented in partnership with Autism New Jersey, a nonprofit agency committed to ensuring safe and fulfilling lives for individuals with autism, their families, and the professionals who support them. Today's webinar is Why Health and Wellness Matter for People with Disabilities and Caregivers. At the close of this presentation, we'll share a QR code to learn about other presentations in these series. I'm so excited that today we have Laura O'Reilly Stanzilis and Amy Golden, and I just want to give an introduction to each of them. Laura O'Reilly Stanzilis is a registered nurse, healthcare and disabilities advocate, and nonprofit executive consultant. Laura is the founding president of Be Well and Thrive, a New Jersey nonprofit dedicated to improving health and wellness of people with disabilities and functional limitations. Amy Golden is Autism New Jersey's first director of wellness. Amy is a board-certified behavior analyst and certified health and wellness being coach with over 25 years of experience. And I'm going to let them take it away. Thanks, everybody.
Thank you.
Thank you for the wonderful introduction. It is an honor and a pleasure to be here today with these esteemed colleagues and all of you who are here taking time out of your day to help understand why health and wellness matters for people with disabilities and their caregivers. And when I say health and wellness is a package. Health and wellness is not simply the absence of disease. Health and wellness is a pursuit of optimal health, emotional well-being, spiritual well-being, happiness, success. It is the potential for us to be all that we can be. And in my role as an advocate, advocating for sustainable, healthy living has been my tagline, because I believe that we all have the right to pursue best health outcomes regardless of our ability or disability. And wherever our baseline is, we all have the potential to improve our well-being. So with the recognition that disability is not an illness, the emphasis increasingly is on the continuity of care and the relationship between a person with a disability and the environment at the physical, emotional, and environmental levels. Now, I'm not just simply reading off a card. I am reiterating this point because it is so important to understand that sometimes when a person with an intellectual or a developmental disability goes into a care setting, sometimes the chief complaint of a person is overlooked. That person could be seen for an ear infection or for a cough, and oftentimes they'll write, the diagnosis as autism or as a disability. And this movement is to really underscore, as it is underscored on this slide, that disability is not an illness. It is a person's baseline of operating, so to speak, and everybody, regardless of their disability, has a body that has an immune system, that has needs, that requires nutrition, that requires physical activity, and that requires routine preventive care. This approach is based on the knowledge that good health means the same thing for everyone. So whether you're a caregiver and you're not feeling well, or whether you are a support person who works for an agency who is feeling overwhelmed, whether you are the client being served who has a routine every day and is essentially going with the flow of a program or a service and may not feel 100% on a given day. We all have the self-awareness or that whether or not we feel well, and we should all be heard. And those who care for people with disabilities should achieve the best possible health status and quality of years of lives to align with their day-to-day activities and work, whether or not experiencing a disability. Now, this was my interpretation of the Surgeon General's call to action to improve the health and wellness of persons with disabilities. At the time of this call to action, Richard Carmona was the Surgeon General of the United States and was the first Surgeon General to put initiatives for people with disabilities into public health practice. And the Healthy People, it was Healthy People 2010, then 2020, and now we're on to Healthy People 2030. And each population health improvement plan on the national level and the state level is inclusive of people with disabilities. And as I get into this presentation, I will elaborate more on where public health stands in disabilities inclusion. So this is just a fact sheet. 42% of American individuals with disabilities are obese, and that's more than 13% higher than people without disabilities. You'll see I got this from the American Journal of Preventive Medicine in 2011. And as I continuously do such presentations and look for more updated information, these studies from 2011, 2012, 2013 are the most often cited statistics. And I would say the reason for that is because we haven't seen a lot of change, just as we haven't seen much change in obesity in the general population, where more than a third of all adult Americans are obese or overweight. So it's an ongoing initiative, and lifestyle, health and wellness, nutrition, physical activity, stress management, preventive care all play a tremendous role in addressing obesity in all populations, because obesity-related illness includes heart disease and diabetes and joint disease and inflammatory disorders. And the more disorders we have, the more unwell we feel, obviously, right? And the more medications we're on. And the more medications we're on, the more side effects there are. And so we go into a cycle of side effects from medication and, weighing the risks versus the benefits of being on multi-medications, polypharmacy, right? So again, I'm going to continue to say health and wellness matters, and it matters because we can do things on a daily basis in our lifestyles that can help us to prevent and avoid and improve our outcomes, whether we have an underlying health condition or not. People with disabilities have greatest incidences of chronic illnesses like diabetes, hypertension, high cholesterol, and other related health complications. Again, from the American Journal of Preventive Medicine, keeping in mind that a caregiver, a person who does not have a disability, often has challenges selecting a healthy diet. Even when we go out and do our own grocery shopping, we may go shopping with the best of intentions and then come home and, succumb to those sweets and salty snacks and unhealthy snacks, and maybe feel tired from a long day at work or a long day at school, and not get out and get the exercise that we need and move our bodies. So imagine if you are a person with functional limitations who cannot move around a lot. If you are a person with a disability and you are dependent on a caregiver or an agency to help supply you with your meals and your nutrition and help you manage your activities of daily living and your activities in the community, the more dependent we are on for other people to help us be well, the more we need to think about who is supporting us and how we are providing support for people with disabilities so that we can help them eat better, live better, be more active, have more quality in their life, definitely leading to quality in their years and longevity in their life as well. People with disabilities, as everybody, need coordinated care and services at a much earlier age than the general population, right? So those of us who have experience working in the disabilities field, those of us who have family members with a disability, we understand that the needs are greater and present at a much earlier age than the general population. But let's also recognize that people are living longer and people with disabilities are living longer. And there is a booming population of older adults, more than ever before in the history of our planet. People are living longer, and there are a lot of people with disabilities going into advanced age. So the same way anybody would want to age in a healthy way, we as caregivers and service providers have a responsibility to make sure that we can also help our individuals served and our family members age in a healthy way. People with disabilities require tailored and inclusive initiatives to reduce inequalities. Inclusion doesn't simply mean, hey, you're welcome to be here. Inclusion in the truest sense means that there are resources and services and programs and ability appropriate opportunities for everybody in the community, including people with disabilities. Individuals with intellectual and developmental disabilities are more likely to be on multiple medications with a variety of side effects. Side effects can include dyskinesia, fatigue, tiredness, drowsiness, agitation, hunger, or a lack of appetite. And some medications slow down digestion and intestinal motility, which leads to constipation. And constipation is a really big issue for people who are on certain medications. So that's where health and wellness matters. That's why health and wellness matters, because with or without a disability, whether you're a care provider, whether you're an individual with a disability, if you're taking a medication that's going to calm you down, it's going to calm down your body systems as well, right? It suppresses you. And so it's important that there is adequate hydration, adequate fiber in the diet, foods that contain hydration, and activity, movement of the body that helps the muscles to be stimulated to help with digestion. Medication errors is pretty common across populations, and a lot of it has to do with the amount of medications people take. Back once upon a time, maybe a person took one medication or two medications, but now in modern society, with a lot of advancement in pharmaceuticals and treatments, people are on multiple medications. And it's really important, whether we're working in a healthcare setting, a residential setting, a community setting, and in our own home environment, that we are regimented when we're giving the medication. We are really making sure that we are in the group setting, right? Always making sure, as in nursing, that it's, the right medication at the right time for the right person through the right route. And even if you know the person, even in the home, if it's your family, sometimes you have 2 or 3 people in the home that are taking medications. You have to be really careful to make sure you're giving the right medication to the right person. You're following the pharmacist's instructions. You're taking medication as prescribed. If you don't take the medication as prescribed, if you don't follow the steps to be careful, it could lead to an error. It could lead to under-medicating or over-medicating or missing a medication. And the best way to reach therapeutic levels in medications that are designed to target a particular condition or illness is to take them accordingly. Another thing is antibiotics. A lot of people stop taking antibiotics when they begin to feel better, and this is not a microbiology lesson here, but it's really good information, and it helps people truly understand why you must always finish a prescription. If a prescription is prescribed for 10 days and that physician's order says take for 10 days or until finished, why you should. An antibiotic is designed to target a particular organism, and that organism has a life cycle. And if you take the antibiotic for 3 days and suddenly you're feeling better, but the life cycle of the bacteria is 7 days, you're likely to get sick again. That's just a small example, but one that usually has people truly understanding why it's important to finish your medication and take it as prescribed, because it is a therapy. And in order to achieve the intended outcome of the medication must always be given or taken as prescribed. And if you ever have any questions about a medication, the pharmacist really is your best friend. Pharmacies are usually open until late at night in certain program settings, in disability service agency settings. There are contracts with pharmacies that have 24-hour on-call pharmacists, so that individuals working in a residential setting who come across a question about a medication in off hours can call a pharmacist and have their questions answered. And the key is, whether it's in your home environment, in your community, in a residential home environment, in a group setting, in a habilitation setting, if you ever have a question about a medication, don't just give the medication without clarifying your question. It's always better to be safe and always better to be knowledgeable. And every time you ask that question about a medication, you've just learned something new for yourself as well. But it's really important to understand that there are people and support resources out there to help prevent any kind of errors and to answer all your questions about medications, whether it's your provider or whether it's a pharmacist. And don't hesitate to ask questions. Self-advocacy and advocating for the people we serve and care for is the best route to best outcomes. Each individual is unique and has a different set of needs and means for achieving those needs. So we can't just make a blanket opinion on what's best for one person is best for the other person. So that's another reason why it's really important when working with an individual with a disability to really understand what their care plan is, what their treatment plan is, what their medication regimen is, what their diet is, what works for them, what makes them happy, what activities help them feel inspired. Improving the health and well-being of a community has to ensure that every individual has access to and benefits from the policies, systems, and environment changes enacted on behalf of community improvement. So in this, we'll go back to community health improvement planning and the Surgeon General's call to action. The Surgeon General's call to action is asking the public health system, the population health system, to be inclusive of individuals with disabilities when they are designing health promotion programs, preventive screening programs, as not to be reactive, but rather to be proactive, to make sure that an environment is physically accessible. If an environment has ability appropriate materials, if an environment has communication materials that are easy to be understood by all individuals and that address those with visual and hearing impairments, and that individuals who may have experienced trauma in their life are approached with a trauma-informed approach to care in the community, so that everybody living in the community is being included and that their needs are being addressed on the community level. And this is outside of the healthcare system. I'm talking about population health, public health, recreation, activities in the community that bring communities together. And oftentimes, particularly in residential programs for people with disabilities, you have staff that come and go and take very good care of the clients, but they don't live in the community. They're not part of the parent teacher association or part of the senior club or have children in recreation. So one of the things that my team and I at Be Well and Thrive like to bring to light in the community is getting connected on the municipal level and on the public health level in the individual community provides people with disabilities and direct support personnel and family caregivers opportunities to truly be part of the community. And there's more on that as we advance in my slides. Accessing quality health care. So those of you who work in bringing individuals with intellectual and developmental disabilities to healthcare appointments may realize that oftentimes it's hard to get an appointment with a doctor. It's hard to find a doctor who accepts the appropriate insurance. It's hard to find a doctor who can see an individual when they need to be seen. And oftentimes there's a utilization of the emergency room in a hospital, and there are laws that require that and should always be adhered to. And also using the urgent care, because we can't always be seen by our primary care provider. And if an individual with an intellectual developmental disability has a provider who they have been seeing for a long time, that provider knows the individual feels comfortable with their provider. There may be limitations to what providers you can see. And, managed care organizations, they do have coordinators. You can call, just like with any insurance company, you can call and get guidance on accessing healthcare in the system. So that's something I highly recommend, whether you are enrolled in a Medicaid, HMO, or MCO, or Medicare, or both, or if you have private health insurance. There are people at the insurance companies who can help you. And there are also health coaches at these insurance companies that can provide health and wellness coaching. That's not typical in this scenario in the IDD community and residential program setting, but it is out there. And there are people who can provide information and direction and guidance on how to navigate the healthcare system. It's a very complicated system, as we all know, to navigate without advocating for others, whether we're advocating for our family or advocating for our clients. So just know that, there are resources, and you can contact the insurance provider and have them help guide you to find a provider who is accepting new patients in the community, or can help you develop a pathway to health and wellness through portals and programs that are managed by the insurance companies. So I hope that's food for thought there, that you can look into what your insurance providers or the insurance providers of your clients have available to optimize health outcomes. Collaborating is really the key to success in anything, right? No man is an island. No one person can achieve all things without collaborating with other people and without relying on people with various expertise. So it's really important that people come together to reduce health inequity and promoting wellness, addressing health and social needs of vulnerable populations, right? So yes, a person is getting their medication and they're getting their nutrition, but are their social needs being met? Are their psychological needs being met? Are there friendships and supports in the community? Are there community health workers available to come and make sure that any cultural barriers are being overcome or structural barriers are being overcome? The healthcare systems at large, hospital systems, have community health workers in the community, And you can reach out to the community health department at a local hospital system and ask about their community health worker program to take advantage of people who actually do go out there in the community. And the social workers, I say this every time I address groups of people talking about healthcare and community support. Social workers are the fabric of our society. And whenever you are dealing with a medical situation and you're not quite sure about discharge planning, or you're not comfortable with having enough support in the community, social workers are available through your healthcare system and through various state agencies to help coordinate the support that we need. That's a whole different subject, but I just wanted to put that in here to really emphasize that collaboration and coordination is a key to success. Care coordination, not just for preventive care. There's primary care, there's preventive care, there's specialist care. And it's really important that there is a point guard, right? A person who can help coordinate these different care activities. And that's why primary care is so important. That's why having an established relationship with a primary care provider and routine physicals are the key to making sure that if a person needs to see a podiatrist or a optometrist or a dermatologist or a gynecologist, all of the information goes right back to the primary care provider. And primary care, again, that's why it's called primary care, right? It is the baseline for all of the other healthcare. And when a private healthcare provider or a healthcare practice is involved in all aspects of the care, rather than just going out and making the appointment with the podiatrist, or making the appointment with the chiropractor, or making the appointment with the gastroenterologist, the information and referral process keeps everybody informed. And once that primary doctor is informed of all of the different care that a client or yourself or your family is receiving, they can help direct you to your next steps. And of course, health education. The more we know about how the human body works, the better we can take care of our own bodies and support the care of the people that we care for. And last but not least of all, advocacy. Advocate, advocate, advocate. If you're feeling you're not being heard, knock on another door. Stay on a call with a doctor or stay at an appointment until you are really sure that all of your questions have been addressed and that all of your answers that you've received are understood, and that you know what the next steps are going to be. Advocacy means standing up for your needs and standing up for the needs of the people we serve, being the voice of the people we take care of and serve, and really ensuring that their needs are getting met. And we're all advocates, all of us in this community, on this call, in our field, we're all advocates. And the stronger we are as advocates, the better the health outcomes will be for our people served. Inclusive community health promotion in preventing disease. So I talked about the Surgeon General's call to action, and we had Healthy People 2010, which was where the Surgeon General's call to action was leading, so that Healthy People 2010 would open up inclusion in the community for people with disabilities and health and wellness promotion. And it did. And it started and it created a footprint. And then Healthy People 2020 expanded it even more. And there are more centers for developmental disabilities that have a whole person approach to healthcare, all under one medical home, addressing nutrition, working with registered dietitians, working with physical therapists to make sure that our clients and our family members and the people we care for are really being assessed, excuse me, as a whole person. And now, as we move into 2030, the Healthy New Jersey 2030, since we're in New Jersey, Healthy New Jersey 2030 has a large focus on health equity and equity in access to services, programs, healthcare, social advancement, learning, earning, and that is to ensure that all people in the community are included and that all of their needs are being addressed. So if you ever come across an opportunity to be part of a survey or a questionnaire from the New Jersey Department of Health, and they're looking for input from people in the community, please participate, because the more you participate, the more voices we have on behalf of those we serve. And if we have a disability ourselves, we can address our concerns directly. There are opportunities to share your voice, and it could be on the local government level. It could be through your local Department of Health. But if you ever see any surveys like that from the health department or related to Healthy 2030, please share your voice. Now, Healthy People programs 2010, 2020, 2030, they identify overweight and obesity as a public health issue. And there are national objectives for reduction in their prevalence. I can't overstate this, because the comorbidities that come along with overweight and obesity are what will open people up to the disease process. And the more we address healthy lifestyle, maintaining a healthy weight, and whether somebody leans on the lighter side or leans on the heavier side, a healthy weight is not just being thin or not just being full figured. It's what is right for you and what is healthy for you, and what percentage of body fat is on your body and how much stress is on your joints, and if you have enough fat on your body. It goes both ways. And again, that's something to work very closely with a personal health care provider on a healthy weight, and have a healthcare provider guide the process for weight management. And that could include going for walks a couple of times a week, and taking certain foods out of the diet, as well as, I'm going to digress a little bit, we have a lot of people in the community have type 1 and type 2 diabetes, and we have some clients that are served and family members that have diabetes, and that can be addressed through diet, and blood glucose can be managed through diet and through monitoring and through making sure medication is administered correctly, and also keeping an eye on the physical activity and learning how physical activity influences the blood sugar, because the more physically active we are, the more we use sugar as energy, right? And so monitoring and exercising and eating healthy are all important ways to manage diabetes, which is a common side effect or a common outcome related to obesity. So improving the health and well-being of a community has to ensure that every individual has access to and benefits from the policy and systems, as I said. And committing to inclusion starts with us. It starts on the local level. It starts with our towns, our counties, our state, making sure that there are ability appropriate health promotion programs available. So in a recent role working with Dawn Center for Independent Living, I had an opportunity to create a guide to local public health and engaging in community-based activities. This particular guide is for Sussex, Warren, and Morris counties, but it also gives an idea of how to find these same resources across the state. So in the guide, we do have state resources, we have county resources, and most importantly, a directory of how to locate your local office of public health. If you care for an individual in the community and your family with a disability, if you have a disability, if you work for an agency that supports individuals with disabilities and functional limitation, connecting with your local office of public health and getting on their email blasts and learning when they're doing vaccine clinics in the community and free and low cost health screenings in the community, and when they are doing special presentations on certain preventive activities in the community, when the town might be hosting a free yoga class or a free senior or ability appropriate chair yoga class. There's a lot going on in towns. The Mayor's Wellness Campaign is an initiative that comes out of the New Jersey Healthcare Quality Institute, and a lot of towns have signed on to that challenge to bring wellness and nutrition to communities. And you may not even know it, but your own town could be a participating town. But the only way to know what's going on in your town is to get connected to your town, get connected to your Office of Public Health, follow them on Facebook, get on the reverse 911, learn how to participate in the community in disaster preparedness preparation, and where to go if there's a power outage. Again, health, wellness, it includes safety, it includes prevention, it includes emergency preparedness, it includes diet, nutrition, exercise, stress management. Caregivers often don't take time out for themselves, and it's really important that caregivers and individuals served alike eat healthy, exercise, take their medication, talk to their doctors, rest and recreation. How great does it feel just to go away for a 3-day weekend and come back and take on the challenges of your life after feeling rested? Even individuals with disabilities need respite from the day-to-day. Even older adults need respite from the day-to-day. Caregivers, students, professionals, everybody needs a break once in a while. So when we think, how do we strategize for a healthy lifestyle? We have to build time for ourselves into it, and we have to manage our stress. Controlling tobacco. Now the new smoking is vaping, so that's something that there is a lot of help for as well. New Jersey Department of Health has resources. Screen NJ is a resource that helps with tobacco education and lung cancer screenings. So really take advantage of what the public health system has to offer as well. And of course, regular checkups and preventive screenings. I cannot overstress how important, I know that's an oxymoron since I'm talking about stress, right? I cannot overemphasize how important regular checkups and preventive screenings are. You might find something incidentally just through a conversation with your doctor, and all of a sudden something that's been bothering you that you didn't think should be something you should bring up with your provider comes up in a conversation, and your provider can direct you to a solution or a care plan. Exercise in the community. This is really important. When selecting an exercise program in the community for individuals with intellectual and developmental disabilities, please be sure that the programs are safe and effective, and that those teaching the class are qualified fitness professionals who are trained to address special needs population. And I would just like to take a moment to share, because I'm very proud of this. When I was at Easter Seals, New Jersey, leading their health and wellness program, and it was thanks to Easter Seals, New Jersey, that I had the opportunity to bring Be Well and Thrive forward. I was hired to run a program at Easter Seals, New Jersey called Be Well and Thrive. And we became the first accredited instructor exercise program for people in the United States for people with disabilities. That exercise program is not active anymore, but Be Well and Thrive is, as an education organization. The reason it is so important is because you want to make sure that people who are teaching exercise programs in the community understand the medications, understand balance issues. So that's why when I had mentioned, chair yoga, and, YMCAs have really wonderful fitness programs for people with disabilities and functional limitations, the Special Olympics, of course, and many others. There are people out there. It is a growing industry. And I say industry because the fitness industry per se is your local gym and your local Y. And that fitness industry is recognizing that there are special needs in the community that need to be taught by instructors who have special knowledge and education about safety and awareness for older adults and for people with disabilities. So I really encourage you to seek an exercise program that is qualified. And what's on your to-do list? I know I have a lot on mine, and I know I'm always finding excuses to not do the things that I should be doing to care for myself, because there always is so much to do, but there always will be something to do. That to-do list, as you know, once you check all those boxes, the next day you're going to wake up, you're going to have 10 more things to do on the list. So it's really important that as caregivers and as professionals who care for people with disabilities, that we create that space in our lives, going back to rest and recreation, whether it's a half hour or an hour or even 15 minutes to just close your eyes and take some deep breaths. Very important to care for ourselves, right? It's the old, put on the oxygen mask first before you help your children on the plane, because if we don't take care of ourselves, how can we be the best advocates for the people that we care for? Chronic disease prevention starts with healthy lifestyle. Again, I can't reiterate it enough, but there are conditions related to being overweight, joint and back pain, blood pressure, diabetes, high cholesterol, stress-related illness, anxiety. Just going for a walk can help ease our anxiety. Just stepping away for a situation that's challenging or stressful can ease our anxiety. But diet, exercise, preventive care. I know I'm possibly preaching to the choir here, but it's just really important that we remind ourselves of how important it is in our lives, and continue to make sure that the individuals we care about and serve get what they need to get these outcomes, to manage their diabetes, to have their medications be medication compliant, meaning, having the medication given and taken on time as prescribed, immunizations, preventive care and screenings, and again, routine health care. Think of the primary care provider as the point guard. They point you in the direction. Here's a big one: privacy. I love this cartoon. For your privacy, is it okay to discuss the test results of your incontinence problem in front of your visitors? Of course not, right? There are certain times where people have to leave the room. And the same for people with intellectual and developmental disabilities and functional limitations. We are all entitled to privacy, and we are all entitled to either communicate directly with our healthcare provider or have a trusted person with our healthcare provider for our clients to communicate with the healthcare provider. We shouldn't have 5 people in a room when somebody is seeing their healthcare provider. I learned about this from a mental health provider of individuals with intellectual disabilities, and she had told me in a conversation that there was a client who had a situation, and a support staff member was in the room with the client, and the doctor picked up on it and asked if he wanted to be alone, and he said yes. And then he shared something about himself with the doctor that he didn't feel comfortable discussing in front of the support person, right? And the doctor really understood that, everybody is entitled to privacy, and it isn't often that way. So we should all be mindful of privacy when we are bringing individuals to their healthcare, and making sure that everything that they would like to express is expressed to the doctor. Again, the importance of privacy and confidentiality. It maintains the trust between the patient and the provider. It ensures the best quality of care, and of course promotes quality of life, well-being, empowerment, and inclusion. We should empower the individuals we serve as much as possible to be involved in their own healthcare. And we should empower the people who are the caregivers to be in charge of their own healthcare and provide them with programs and services and resources to help them achieve their best health as well. And then one more resource I would love to share. It's the National Center on Health, Physical Activity, and Disability. They are the premier resource for information on physical activity, health promotion, and disability, serving persons with physical, sensory, and cognitive disability across the lifespan. They feature a variety of resources and services which can be found on their website. I had the wonderful opportunity of being involved in 2 projects with them when I was at Easter Seals. One was the Commit to Inclusion project. We partnered with St. Joseph's in Paterson, and we did health and wellness and nutrition programs for teenagers with developmental disabilities. And we also were part of the Community Health Inclusion Index, which was out of the University of Illinois, and it helps communities recognize how accessible they are, going into stores and going into community centers. And now, of course, with new construction, everybody's required to be ADA compliant, but it wasn't always that way. And older buildings needed to be retrofitted to include everybody. But again, inclusion is not just the physical access, it's the whole person access. It's understanding the special needs. And I would like to thank all of you for your commitment to inclusion, and I encourage you to encourage others to commit to inclusion. Thank you. Now I would like to turn it over to Amy Golden of Autism New Jersey.
Thank you so much, Laura, and thank you, Alpine, for having us here today to talk about health and wellness and its importance. I am here to represent Autism New Jersey. We are a statewide nonprofit agency that's committed to ensuring safe and fulfilling lives for individuals with autism, their families, and the professionals who support them. So a couple of things that I want to mention. We have a helpline that's 800-4-AUTISM, and you can see that right here on the slide. And you can call our helpline to talk to our information services department to learn about a wide variety of topics and get resources and referrals for different types of programs and supports in the community. So a really nice resource. We also have our annual conference in the fall, which takes place in Atlantic City. Today, just to continue the topic on health and wellness, I want to talk a little bit about the Autism New Jersey Healthcare Consortium. The mission of this consortium is to seek the wealth of knowledge, expertise, and resources of members in the community who work in healthcare to collaboratively develop innovative solutions and to advance best practices in patient, provider, and systemic aspects of healthcare for patients with autism. So we're really looking to broaden and elevate the conversation about healthcare needs and solutions. And we have a couple of activities that are included in this initiative. So I will talk about those. The first is increasing timeliness of diagnostic evaluations by qualified healthcare providers. We have a work group that is currently focusing on this. And the work group consists of a variety of healthcare professionals who are invested in exploring different options when it comes to improving the wait lists that exist for diagnostic appointments. Because we know that, families are waiting for a really long time. And with the time passing, sometimes parents aren't really sure how to go about addressing, some of the aspects of their child's development. So we have a group that's working on this to share information and to collaborate and talk about some clinical efficiencies and look at just some possibilities for broadening clinical training and support so that other healthcare individuals can diagnose autism and really cut down on those wait lists. We also have our consortium working on advancing autism-friendly best practices. So we have a group of healthcare organizations that come together several times a year to work on this specifically. And they're working on some healthcare improvement projects, looking at figuring out what are the best autism-friendly practices that healthcare providers can use in a variety of settings. And then, we will be looking to disseminate those practices so that they can really be incorporated in a variety of medical settings. We also have our medical equipment lending library, which is a really unique program, and it's for providers who are interested in working with autistic individuals to help acclimate them to different medical equipment so that they can be better prepared for various medical appointments, which is very helpful when, a lot of times parents or providers are taking individuals with autism to medical facilities, and there's a lot of challenges related to that. So we're trying to help providers to provide that training and support for individuals so that they can learn how to kind of deal with some of those challenges a little bit more proactively. We also, sorry, I advanced. We have a healthcare experience survey on our website, and our website is autismnj.org. And the goal of that is to gather information about lived experiences of family members of individuals with autism and autistic individuals, so we can learn about access to needed healthcare and how their interactions with healthcare providers went. Because we know some people have really excellent stories and some people have experienced some significant challenges. And the goal of this survey is to collect data to share with others so that we can help guide priorities and activities throughout the state and just work on some improvements through our Advancing Healthcare initiative. So the survey is still available on our website. We've had it available since October of 2022, and we're continuing to collect responses because we really want to hear about the experiences of individuals in the community, so that way we can further educate healthcare providers about those experiences and, work on advancing the whole arena and forum of healthcare, and, just making sure that, like Laura said, individuals go to healthcare appointments. All of the appointments are attended and go better, go best for individuals with autism and their caregivers. The next thing that I wanted to mention is our family wellness programs. We have a new program, and that is health and wellness coaching sessions specific for caregivers. So Laura had mentioned earlier in the presentation, what do caregivers do, right? Understandably, we hear from caregivers that they are putting aside their own needs to help support their family member with autism. And we know the importance of self-care. It's really critical to being able to help yourself and help everyone in the family. So the goal of the health and wellness coaching groups is to partner with caregivers to identify their strengths and their resources so that they can make sustainable and healthy lifestyle behavior changes. And as part of those groups, we encourage participants to self-assess. So really looking at all of the domains of health and wellness to see where they are now and where they'd like to be in the future, and then develop their own goals based on their own personal vision for health. The groups introduce strategies to promote motivation and positive habit formation, and they're provided during a series of 6 coaching sessions in a virtual group format, and they are also free of charge. So if this is something that you're interested in as a caregiver, I would encourage you to go on our website, autismnj.org, and click on our Family Wellness tab, and you'll see an area to sign up, and then I would be in touch with you to get you involved in a group. And that is what I wanted to go over related to Autism New Jersey and our healthcare initiative and our family wellness resources. And I just want to thank Alpine again for having us to talk about this very important topic. And I will turn it over to Dr. Taylor.
Thank you so much. What a great, just such terrific information. I know all of us consider health and wellness a priority for ourselves, and it's certainly important to consider health and wellness for our loved one with autism or the individuals whom we work with. We have a few minutes for questions. If you have questions, if you can please put them in the Q&A. I don't see any questions there right now. Okay, well, since there are no questions, I did want to thank you for being here. As a reminder, this webinar is the final one in a series of free webinars that we conducted throughout the month of April for Autism Acceptance Month. All webinars were recorded. Feel free to scan this QR code to learn about more webinars in this series. Okay, well, I just want to thank everybody for being here. Thank you so much to Laura and to Amy. And that's it. Thank you, everybody. See you next year.